My name is Heidi Stoeckl. I'm professor in public health evaluation here at the Ludwig-Maximilians University in Munich. And my work is focused on a couple of key topics. The main topic I work on is violence against women and girls. I also work on migration, labor exploitation, and homicide. There's one project that I want to mention where actually the policy impact was immense, although obviously it was a bit indirect. So I've been part of the team between the London School of Hygiene and Tropical Medicine, the South African Medical Research Council and the World Health Organization, where we gathered global evidence on the prevalence of violence against women and girls, especially intimate partner violence and non-partner sexual violence, and the health outcomes that intimate partner violence carries. And this was a project we did finished in 2013, and I played a small part on the prevalence of homicide by intimate partners for men and for women. Intimate partner violence became one of the targets of the Sustainable Development Goals. So that's the reduction of intimate partner violence, physical, sexual, and emotional. And it actually became part of two different Sustainable Development Goals, also the one on reducing violence in general in the population. And I think it's this lobbying based on these estimates of 1 in 3 women worldwide experiencing violence by their partner or non-partner that really led to this inclusion of this target in the Sustainable Development Goals. And this is a goal and a target that governments are held accountable against. They have to present I think every 5 years, a report on what they have done to reduce the numbers of intimate partner violence and non-partner sexual violence, and which actually led to an increase in the number of surveys, but also an increase in interest in what works to prevent this issue. So it is this very early research, I think, that laid a really good foundation for comparing also governments. Have you actually achieved something? You have done a survey in 2013, you are now doing one in 2020. Have the numbers changed at all or not? So I think that's this success in some way that really also, keeps me going some way in research, because sometimes it can be quite lonely. You're behind your desk, you don't see the impact. But even something that was done at that time that didn't have this direct impact that you could see actually had a big effect on what is happening in the policy world. We are so in our research world where we communicate in a certain language that is also important in the academic world to be credible. And this is why you often speak very technically, with very technical terms that not everyone understands. And so it's quite uncomfortable to then really sell your main messages that don't have this technical comfort zone, I would say, to someone who doesn't think in that technical way, but still be convincing. And in some ways, at least I and many other researchers spend a lot of time on their computers with their statistics programs, with, in their rooms or on calls with other academics, and we are not really used to that kind of interaction. So sometimes I think that is the real challenge, to leave your comfort zone and to really get engaged in this other world. And I think it's also because that takes resources, that takes away time to get to know, how to best approach it. And so that's the second challenge associated with it. It's time that you then have to take off your research to also be credible in this other world and know the tricks and how to be convincing. So I think it's that combination. So I would say there are 2 or maybe 3 different types of how I work with policymakers, and I will explain them to you by examples. One is that I'm a member of the Sexual Violence Research Initiative, which is one of the largest non-governmental organizations that focuses on researching violence against women and girls in low and middle income countries. And they have a forum every year, every second year actually. And to this forum, researchers, policymakers, donors, and practitioners are invited who implement projects on violence against women and girls, or who fund it, or who are aiming to change policy in addition to the researchers. So there are a lot of different forums at that forum where there are discussions about what are the most important policy questions we face right now, what are the new emerging interventions where we know it works against violence against women. So there's a dialogue that happens there, and I would say it generates a lot of ideas about where the next research is needed that then can fit into policy. The other example would be my work with the World Health Organization, where I have long-standing collaborations, which actually started with my PhD. During my PhD I did an internship with the World Health Organization. So I met a couple of key people in my field who work for the World Health Organization. And we kept in contact, we met again at different expert groups. And this is through discussions that these issues would come up, and we would find either joint ways, or they would start working on the idea, or I would start working on the idea, and then we meet at a later stage again to exchange this. Through some collaborations with my researchers in Tanzania, we started to have, we just actually, it was a simple conversation. We talked about sexual harassment and how common it is for her daughters to experience this when they would go out in the city. And we decided that this is actually an issue that we really want to study. We want to find out how women and men conceptualize this issue, what they actually experience, and how they differentiate sexual harassment from kind of more flirting behaviors and sexual violence. But at that time, and we did a research project on this and carried it out, published it, and then I got into touch with WHO, and we talked about non-partner sexual violence, and I mentioned that we actually have this project that we want to push further to really understand how we can measure sexual violence and sexual harassment, across different settings, not just in Tanzania, and how we want to build up a measurement tool. And WHO said that this is something that would also be really interesting for them because they are running the WHO multi-country study, and researchers across the world ask for what measurement tools they should include. And in addition, there's a big policy focus on the issue right now. So they actually need good data on it to know what's the scale of the project, the problem, what are the health consequences for it. So this was another way where the initiative actually really started from, my team's end and my collaborators in Tanzania, and then that led potentially to a bigger project in the future. A third example would be from my work in Tanzania, which started off with more research work, where we worked on different forms of violence against women, the prevalence, the health outcomes, but also what interventions would work, that my Tanzanian partners at the end of the project would set up a meeting, a stakeholder meeting, that's how they call it, where they invite government officials and other relevant key stakeholders in the ministry locally as well as nationally to hear the research findings and to discuss them and see how they can be of use for them. So yes, I think it is important to have different strategies because different countries or different organizations all work really differently. So for influencing an organization like the World Health Organization, you need someone who's inside that organization, who knows how the organization works, how to make changes within or through this organization, who then also knows how to talk with other international organizations and how to bring them on board. And they are very good in getting this international consensus, but they have already certain processes in place how to achieve that. So it does require some lobbying from the researchers' side and to get issues done, but then it's really working with the system. They also know the windows of opportunities, when is a good time to bring up an issue, or through which, in the World Health Organization's agendas and, different forms they have it. Working in Africa, you need a different strategy because, first of all, the research I do in Tanzania now, as the best example, is with a local team anyway. And so they are also the people who know best how to, do this policy work. They know whether it's best to involve politicians and key stakeholders in the very beginning, and then they know the appropriate formats how to do it once the research findings emerged. We know that it's really important in that setting to involve people very early so that they feel included, they feel ownership of it, and they also have an opportunity to influence some of the research questions or the methods and how this is conducted. And there it's also really important to involve people at different levels. I mean, that's already important for getting permissions about the study, but also to really make sure that the knowledge is then widely distributed. In the European context, I had experienced during the COVID pandemic that we were approached actually by the World Health Organization, the European office, that really needed evidence in order to influence policymakers about what strategies were successful in the COVID-19 pandemic to reduce and to prevent violence against women and girls. So they asked us to conduct a rapid review where we literally looked at what strategies each country has done during the COVID-19 pandemic, and just to kind of get some evidence about what might work and might not work. And they used a very different dissemination strategy. So they had access to a lot of mayors in different European cities, and who would be then invited very early on, even when we just planned the study, about the questions we would ask, what the research design is. And this was partly to get them to participate very early on as well. So they have different channels and different pathways that normally in my research I never engaged with. They have a regional collaboration of cities in Europe where they would have access to a lot of policymakers and service organizations in these cities. They would work with European organizations working on gender inequality. And they would also reach politicians in another way. Also there, the European Director General of the World Health Organization then was quite vocal in the newspaper about how to prevent violence against women and girls during the COVID-19 pandemic. So he was very vocal about it, and that got a lot of attention as well. Actually, certainly. I think academics are not necessarily the best people to do the policy work. And I say this because we have all this knowledge, we generated all this research, we are full of our findings, but we're also very full of the limitations of our findings because this is what we are trained to do. So sometimes it's very difficult for us to get information across in a simple way that's easy to understand for everyone, because we're always thinking, but this is only valid for this and this part of the population. And I have had the good experience to work with a team in Oxford about adolescents' health across sub-Saharan Africa, and they have done, I would say, a lot of things that made life a lot easier. They had a special communication person who would work with us how to make our research findings more succinct, how to get the message across better. They also had very great visualizations that really helped to get complex finding in a graphical way that is easier to understand and accesses more people. But then they also hired people to work, for example, with UNDP, that's United Nations Development Program, and who knew people in this institution and who knew who we can connect with, how we can connect with. And that just took a lot of burden away, I would say for me and for other researchers as well, I believe, because we are always a bit struggling who's the best access point or not. And they also supported us, for example, in Tanzania, who we could approach, thinking beyond our boxes and our normal relationships. I also had a very nice experience with another collaborator in Tanzania who's actually very well embedded within the government, and where it would actually happen the other way around, that the government would come to him saying, we have this national action plan to prevent violence against women and girls and children, but we don't really have any evidence on, for example, violence against children prevention. And there is this WHO guideline that we should adhere to. Do you actually know anyone who does research, ideally from Tanzania, who can tell us something about it? So he was actually becoming a kind of broker to bring together a lot of Tanzanian researchers to then provide the Tanzanian government with this information. So the two of us got together and decided that we want to build up a network of Tanzanian researchers who then can form a pool where the government could also go and get their local experts and their local expertise as well, especially when they have specific questions. So that all relied very much on a single person who was a gatekeeper for that. I think that's a really good question, and it's actually something where I'm very strict about, because I would not go to, for example, Afghanistan or Bangladesh or Zambia and say, this is my research question and I'm hiring a survey firm and they should conduct my survey. Because I do think that for me, it's mandatory to work with someone from the country and also to work with them on an eye level and in a real partnership. And that's actually not always that easy, because the way funding mechanisms and things are set up, they are unequal in nature, because the funding often comes through northern institutions and then they will come to me and then I'm the one who's responsible. But I think it's something that is quite important very early on to find people where there's mutual trust. So it's trust from their side that there's no exploitation, but also trust from my end that there, it is an equal relationship and I can rely on them that the work will be done. But I just, from my experience, it's so much more valuable to really have this engagement very early on, even when it's about the research questions and how things will be done, because it is so easy to get things wrong and to not understand the local context, and that influences recruitment, that for participants into the study, that might lead to very inappropriate behavior or questions. And this starts with things like, how much do we reimburse participants, what is an acceptable amount of reimbursement, what is unacceptable, and so I think this feedback is really important. And also we come up with findings that we find very difficult to interpret. We work on very sensitive topics on violence, sexual behavior, alcohol, mental health. So you need to have a very good sense. And you also need to know where you could refer people. So there's a lot of issues in the research process. But then even more in the policy influence part of the research that comes later. Because if no one in the country feels like they own the data, they understand the findings, they agree with them, no one will also push for it. I think you have to really push yourself in some way, because it's nothing that you feel very comfortable with. And the one thing that you need to try is to start writing really simple messages and really think about whether these simple messages are still true and whether you can kind of live with them. Live with them means that they really still say what you want to say. And then think about different outlets where you might want to present them. Not that I'm that good on all these social media parts yet, but I know that it's a very influential tool, and it's one very easy thing where you can start getting into, how you make messages, how you put out your research finding, how you promote your own work. It's not something that everyone can do very well. And then I think it's attending, meetings and conferences where there is more focus on policymakers. So don't just stick to the typical academic world, because that won't get you anywhere. But like in my case, I'm very active in the United Nations Trust Fund for Violence Against Women. I'm very active in the Sexual Violence Research Initiative that works with practitioners and policymakers. So getting involved in these scenes, and then things will come up and emerge. And then it's even other things like TV interviews, writing like shorter pieces for newspapers, that all, it all kind of gets your name known for someone who's not just in the academic sphere, but also is in a more policy relevant field, and things will emerge from that as well. I think it's quite important, because, the unfortunate thing that sometimes scientists learn at some point is that the evidence itself doesn't change politicians and they don't change policymakers. There's an array of things why policymakers might focus on your topic and not, and the evidence part is only one part of it. So I think the direct lobbying is one part, but also just putting an issue on the agenda. And that's something you can do through TV interviews, newspaper things, or social media increasingly, is part of putting an issue onto the political agenda. And that might then get politicians to react to it. I think, and that's coming a bit back to your previous question, what can you do as an academic? I think you can get training on how to be a better communicator, how to engage with newspaper interviews or TV interviews. So I managed to get some training on communication training on how to deal with newspaper, requests. And the main thing that I learned is prepare your 3 points that you definitely want to say, and make sure that you say them in that time. And then, because newspaper interviews and TV interviews, they come out of the blue and they call you and say, can we talk to you now or in an hour? And you don't have much time to prepare, but then focusing on your 3 main points, making sure that this is what you want to say and this is what you don't want to say, is something that you can train a little bit. So I was really glad then that I did this training when one of the first newspaper interview requests came, because at least I felt a little bit more prepared and sure what I can and what I can't do. And I think the other advice would be to expose yourself. So if there's a request, don't say no because you are really scared, and just try and do it. And the next time will be easier, and the third time will be even more easy. And so that's one of the, tips I can give younger upcoming researchers, to just expose yourself and do it, and at some point it will be easier.